For this first panel, we are going to get into the gig economy and employees and benefits and really important topics. What does it look like for us to think differently about about providing gig workers with benefits? The gig economy is growing, and a decade ago, the sector was small and largely informal. But today, 1 in 3 U.S. workers is engaged in gig work. And by 2027, which is not that long from now, it's estimated that about half of the U.S. population will have engaged in short-term and or contract work. Now, I'm not going to say much more about this because we have incredible panelists and experts on this topic. I'm going to introduce them, and we are going to give them a round of applause as they take the stage one at a time. So first up is Makeda Henry-Nicky, the Robert and Virginia Hartley Fellow in Governance Studies at the Brookings Institution. So let's welcome Makeda to the stage. Yeah, that's you. Perfect. Next up is Ben Geierhahn, the CEO of the Workers Benefit Fund. Let's give him a round of applause as he takes the stage as well. Thanks for being here. And then last but not least, we have Monet Williams, partner at McKinsey & Company, taking the stage. Great. Well, thanks for being here. How are we feeling? Good, great. All right, so when I talk about the gig economy, I want to level set for a moment to make sure we're on the same page, but feel free to challenge me because that's what we're here for, some disruptive discourse about what we're even talking about here. But when I'm talking about the gig economy, I'm largely referring to 1099 classified workers across the board, whether they are working in the gig economy like we traditionally think about it, Uber, Lyft, TaskRabbit, or freelancers or independent contractors that provide short-term project-based services. Now, before we get into the specifics of what inclusion could mean for freelancers and gig workers, I want to kick it over to you, Monet, actually, with this first question, because I'd love to get a sense from you about what inclusion in the workplace even means, what that looks like, and some of the things that you've done and that your company's done over at McKinsey to address issues of inclusion or the lack thereof in your context.
Sure. Thank you for the question. So one of the most important parts of this is as we think about inclusion in the context of the current labor market. We hear about the great resignation, the great attrition, the great attraction, all of these different dynamics when we think about the lack of people staying in their current roles and looking for better opportunities. One of the things that we see is that organizations think they know what employees or workers want, but they definitely don't. When we look at the overlap of what employees say would make them want to work for a company and or stay, there's not a lot of overlap with what employers say. And one of the things that employees regularly bring up are these big relational elements, sense of belonging, feeling included, looking for opportunities to have a manager that they think cares about them and is committed to their development, systems of meritocracy and fairness at work. And lots of times organizations think it's more transactional compensation. Obviously that matters, but it's not enough, and other things around other standard benefits. And so one of the things that you really need to do first is understand what people actually care about in the context that you're working in so that you can provide those things. And then the second thing that organizations are starting to do more of is really looking at how different groups and organizations are experiencing those things differently. So you could have a really good performance management system, or you think you do, but you ask a few people and it's differentially experienced by folks. So maybe white women have one experience at work, black men have another. How do you think about bringing those things up to an equitable level of experience as you're rolling out different programs as well? And then the last thing I'd offer around what companies are thinking about and trying to do now is really creating connectivity across organizations where it didn't exist before. So in the virtual world, are there ways for people to find each other where they may not find each other in a physical location as they would have pre-pandemic or in other work contexts? And are there ways for people to get together in employee resource groups and find commonality so that they can address some of these issues and provide that feedback to their employers? And more companies are looking to help employees do that as well.
Great. Why would you say, building on that, why is inclusion so critical for companies? I think we all probably have a sense of why we think it's important. We're in this room today, but I'd love to hear from you. Why is this actually really, really important for leaders to be thinking about?
I think there are two pieces or three pieces. The first is that people are much more willing to stay. We hear, in fact, nearly 50% of people are willing to take a job if they believe the company is inclusive. So there's a big draw and then getting people to stay once you're there. The other stat that I think is so interesting is nearly 90% of employees of all backgrounds, say that they're more willing to help a colleague or a coworker if they believe the organization is inclusive. And so getting to get more out of people feeling that they really want to contribute in that way and creating the environment that people can do that and want to stay, I think is an important imperative given the current talent market that we find ourselves in.
Thank you for that. Thank you. I want to kick it over to you, Makeda, and to ask you, so studies show, like I indicated even in opening this panel, that gig work is growing. It's anticipated that it will continue to grow, and eventually it may outpace current traditional employment opportunities and what that looks like for us. And so given that gig work could become the dominant category of work, what strategy could employers implement to reduce the racial wealth gap that is likely to incur with the gig economy continuing to grow? There is an assumption in here that the gig economy will, if not already, that it will exacerbate the racial wealth gap that already exists. And so what are some of your thoughts around what employers can be thinking about as it relates to the racial wealth gap and gig economy workers?
Thanks so much for the invitation to be here to talk about gig workers in specific. I mean, I think there aren't enough conversations about these folks and the implications of the future of work or this disintermediated labor market moving forward, what it means for them in their lives. So let me back up a little and say, globally, the size of the total value of gig work is about $204 billion. And so you think about how that's divided. 67% of that goes to gig workers. The other third to companies, the ones you listed, in commissions and fees. But nowhere in the middle is an allocation for benefits. Think of us in formal work. Portion of that labor income comes in, it goes to taxes, some of it goes to benefits, and the rest of it we take home. And that mix is missing in the gig economy. And so when you kind of peel that back and say, well, what's pushing people more and more into gig work? It's because the middle class has been shrinking and shrinking fast since the 1980s. And so if it's shrinking, people get trapped at the bottom. They can't move to the top. That's where wages are lowest, mobility is flat to non-existent, income volatility is high. I'm going to picture for you what income volatility means. It means like today I earn $1,000 for the month. Next month, my income can drop as much as 30%. Can you pay bills, predict your housing payment, your car payment, and health insurance, and that kind of volatility? That's increasingly the reality that gig workers are, find themselves embedded in. And so employers need to kind of sit back and ask themselves, what are the drivers? Human-centered design here in social policy. What pushes people into gig work? What do they look like? Because they're firefighters, they're teachers, some of them are bankers. They're just not able to make it on the kinds of flat middle-class incomes we've seen in the last 40 years. And then ask yourself about work broadly. It's become fractionalized, disintermediated, meaning there's less relationship between these inclusive employers and the workers at the bottom of the scale. So how do you protect them? How do you secure them? Securing them means we put together some new ideas about portable benefits. When I say portable, I mean benefit packages that are broad, that cover health, retirement, emergency savings, but also paid time off. I mean, you've seen what COVID has done to families that have family care burdens, and once they take off, that volatility kicks in again because they have no money to cover that sick leave or the medical expenses associated with taking the time off. So it has to cover, paid time off for all of these various reasons. But the portability, the real power there is that it cannot be tied, should not be tied to a specific employer. That's where things get locked in. I think you'll talk a lot about some of the models you've worked on, but the Black Fund Taxi here in New York, 1999, beautiful model that allows, taxi drivers, some of the most volatile people in terms of income here, to move around, to go from place to place and company to company within the city, right? And kind of secure themselves. But because New York has been, as I was saying to Monet before, completely gentrified since the time I was living here, that benefit terminates as soon as they think of, Hoboken, New Jersey, or some other place where the markets are accessible. So employers have to ask themselves, what's driving all kinds of workers, middle-class workers included, into gig work, and how to secure them. We are at a point in which inequality And lack of mobility is now costing every single one of us, regardless of where we sit in the income ladder. That's where we are, and that's what COVID has shown us. So, I mean, I think it's really important to kind of look back, not just employers as well, but where are our tax laws implicated, our state and federal laws implicated around this relationship between benefits, workers, and employers. The fact that I can get an employer-sponsored health insurance company plan, it's because I'm classified as an employee by the tax code. But if my mother, who grew me up as a seamstress, wanted to get that access, it's not subsidized in the code. It becomes exceedingly expensive for her. And that's part of this sort of lack of mobility or instability and insecurity. In fact, all that conditions low income status for a lot of our people who are people of color in these different jobs.
So I'm curious to hear, Ben, do you have any thoughts or reactions, responses to what Makeda shared? I have a question, but I could see that you were thinking something, so I want to invite you to share.
The first thing we talked a little bit about this before, we have to include part-timers in the realm of people when we talk about gig work. I know that they have some work protection, but they don't have health care. They have workers' comp, which is the one thing we do right here in New York for Black Car Fund, Black Car drivers, is we do work comp, which is a super important protection. But part-timers are in that space of very high insecurity. If they have an illness is going to incapacitate that family. And I would argue that at the lower end of the spectrum, even employment, there are a whole bunch of people who have really bad health care, and health care is the thing that is bankrupting people. I haven't, it's been a little while since I looked at it, but healthcare debt is one of the leading causes of bankruptcy in this country. It is someone in the family gets sick, because most companies don't cover the entire family. If that's a child, the family's going to mortgage everything. The debt is going to be enormous. It's just catastrophic. So if we're going to talk about benefits, we have to talk about families having health care, and we have to talk about people being underemployed and having under benefits. So begin there. On the gig side, I don't have anything to add except that I think that we do have to find a way to provide portable benefits. We have been working on that here in New York, and for that you have to put everything on the table. My particular predisposition is that you have to have organizations which represent workers to help solve these problems. Because the only time we've seen significant improvement in the benefits and the rise of the middle class in this country is when there have been powerful labor unions. We should not be surprised that there is a greater separation between rich and poor in this country at every level at a time when private sector unionization is at its lowest. I think we're seeing a little bit of a turnaround on that now. I hope that has, is a harbinger for things to come. Although I have to say I'm probably less optimistic than most people, because a lot of what we're seeing now still has to turn into contracts. It still has to turn into things that are organized. And in New York, as many of you know, we got one Amazon warehouse, and then the one right across the street. I don't know if everybody knows this. It's physically across the street. Failed to pass a union vote. So I am hopeful that will change, and we can talk more about it.
Great. So I'm curious, and this is also a question for you, Ben. Where do you see, from maybe not necessarily from a public policy standpoint, but where do you see the greatest area of opportunity for advocating for these benefits among gig workers? You were speaking to the importance of labor unions just now, but I'm wondering if there's anything that you would add where you see, this is a great opportunity. We're not thinking creatively about this. We need to move in this direction. So
I'd start by saying let's stop looking at the Fed. We spent a lot of time. I happen to work on a whole bunch of legislation this year where workers would have a say in what they do in the gig economy, and we were told by told by the national unions, hey, we got this thing called the PRO Act. The PRO Act is going to pass. If you asked them where they were getting 10 Republican votes, there wasn't anybody who could tell you where that was going to happen. We got to stop believing that the federal government is going to solve our problems as it relates to labor, as it relates to working people. Until we have 60 votes, and I was thinking about this morning before I came here, it took the last time Democrats had 60 votes in the Senate, right? We had two things. We had a generational politician in Barack Obama, and we had an economy that was in complete free fall. So you had two things pushing us towards a big legislative, having the power in government. And by the way, it disappeared in 3 months when Democrats lost a seat in Massachusetts, of all places, right? We're not getting there. And so if we're waiting for there to be a federal minimum wage, for the federal government to bail us out, we have to forget that. So what we need to be thinking about is, what can states do? How do we give people who represent working people, and I mean unions in this case, but it can be other things. How do we give them the space to act? In Washington, there was a bill recently that passed only with the support of all of the local labor unions, all the local labor organizations were for this. The national was opposed. Everybody at the national level, I was opposed. We thought it was a terrible bill, but I knew these folks, and my only argument was like, let's give them the room to represent the workers that they know best. We have to have grace around this with with the people who we care. If you believe that people are in the right place as it relates to these issues, give them the space to experiment at the state level.
Great. Monet, I have a question for you. As a consultant, I'm sure you work with many C-suite level people across different corporations and industries who are managing 1099 workers. And so what are some of the main factors that are influencing their decisions around whether or not to offer benefits? And what changes have you observed in the social contract between employers and employees? I think you maybe spoke to that a little bit earlier, but I am curious about that C-suite level thinking and again, what's coming up for them as they think about this benefits piece for 1099 contract employees?
I think you might be being more generous with the conversation. I think the beginning part of it is I have this problem I'm trying to solve. Like, where can I get the skills? And so the benefits conversation is so far removed from that part of the conversation right now until we start talking about the retention and attraction issue. So people are often thinking, oh, okay, like I need someone who does social media. I need someone who writes. I need someone who does this very niche thing that we don't have an internal capability for. And they do see freelancers, part-time folks, other folks in the gig economy as real resources to plug those capability gaps. And in ways that they just wouldn't be able to do, especially large organizations, quickly. Being able to do this quickly helps people move faster. So I think that is the problem that a lot of organizations are trying to solve. I think the benefits question only comes up when people are saying, oh, well, this person didn't say yes. This person didn't renew a contract. This person said that they don't like how we do such and such process or how things work here. And then you start getting into this, oh, okay, I think we have to rethink how we're attracting people, keeping them, the things that we're offering. And so I think the conversation is coming in a much more reactive way, and as a result, it's probably not as strategic as it needs to be. And some companies are starting to wrestle with that now, but it's still pretty nascent, especially for large organizations.
Back to you, Makeda. And if you have anything to say in response to Monet, I'd love to hear your thoughts on that as well. But I do want to ask, much of the discourse on reducing the racial wealth gap has focused on the responsibility of employers. And less has been said about the role of government and how the government can facilitate this process. And so what types of policies would be effective? And is there a role for perhaps public and private partnerships and initiatives in this work?
It's a complex question, but I do agree with Ben's summation. To think that there's a role for the federal government, there's a role, but will they play it? Is there political will? Absolutely not. Here is where I think states they've got the runway. They have the autonomy. They've got the legislative flexibility to do the creative things that need to be done on behalf of workers. In 2017, I think there was a bill that it didn't go anywhere, but in Washington that tried to stand up a state level kind of shared social security fund where big gig companies and workers and also customers, like the Black Fund piece that they pay a surcharge, those monies would go into this pool, and out of that, workers could draw on that for their missed days for sick leave or transitioning in between jobs. So it'd be nice to see those kinds of models come back online. DC, for example, just passed last year a phenomenal paid time off leave policy that they're now broadening to ensure that it's portable for childcare workers and the ones that are most vulnerable. So states, you've got your primacy. You've got to just use it and want to act on behalf of, I think, what will be the most politically active voting bloc that currently is underestimated and underappreciated. The third piece I'll say is the folks in this room understand a capital stack. Workers are building a benefit stack, and they do that every single day. That's, to me, gig work that is invisible and it's not valued or even framed by any single person. So if you're looking at where the wealth gap, $188,200 is the median family wealth for white families. For blacks, it's $24,100. 8 times is that differential. 8 times. To close it, you have to ask, what are the ways in which Black wealth is leaking out of Black family pockets? Let's start with healthcare. Now, an HSA product, to the folks in this room who can go back to their development and marketing teams, is a good place to start, right? Where you can say, they're already, not paying taxes or however that tax relationship works. Do not quote me on that. But you can see a world in which an independent contractor has access to a universal HSA product that travels with them, that gives us some modicum of protection and benefit, like us who have these W-2 jobs. Into that fund, gig platform economies need to pay into this because there's competition. They are working with a three-sided network. One side, customers who want to have their ride show up in under 5 minutes. But a big part of that are the drivers. And so if the drivers aren't on these networks, then that business model fails. So if you can work with an Uber or a Lyft to stand up this kind of novel HSA product, we'll figure out the employer relationship and the tax code. But essentially, that provides a kind of competitive protection that no other company is thinking about. But it translates to real-time benefits today. Today for their families, for their daughters. And that means we can stop pushing all the healthcare burdens onto these families, and some of those dollars you can actually save some of it and start to go back to that, wealth gap and start to close it incrementally. But it's not going to come from the federal government. It's not going to come from just state governments alone. The marketplace, market-oriented policy folks have to be a part of this design space to think about ways that we stop or minimize the leakage and erasure of Black wealth. That's health, biggest piece. And I think HSAs are a great way to start on all of those fronts.
Thank you. Oh, take it away, Ben.
I may disagree here. So one of the biggest challenges. So just so folks know, I actually design benefits for Black car drivers. We had to put together what we're delivering. The most important thing and the most important lesson I learned at some think tank thing, and I'll not remember what it was, that someone said complexity is oppression, right? And that is the biggest problem you face with all healthcare products. So I deal with drivers. 91% of the drivers here in New York were not born in this country, right? They come from every background, and I was saying to my fellow panelists, the only thing they share in any real way is they distrust everything. And so you have to deliver, you have to make it simple, right? And so the thing that we always think about when we do delivery of benefits is make it simple, make it usable. And what this normally means is not $1 its first dollar's got to be paid for. And so my concern about any product that's complicated is that the driver will just throw their hands up and say, I can't think about it. There's a study, and I'm not going to remember it because I'm not academic, so I can't quote these things. But that talks about why people go to check cashing, and there's a whole thing about complexity, right? Most of these folks have checking accounts. They walk in and they say, well, why? When they did interviews with folks about why would you have a checking account and go to check cashing? Well, I put the check in my bank account now. I've got $1,000. I write my check to pay my electric bill. I get a $35 overdraft. I don't understand. I put the check in there. I get another $35 overdraft because now, it's hit me again. But the money's in the account. I've now lost $70. You know what? If I go to the check cashing place, they give me the $1,000. I walk out with it in my pocket. I put $300 in my checking account. I paid the $20. The complexity is taken away. The same is true of benefits. So the way we're thinking about healthcare is most of our drivers are in the public system. They've got either an Obamacare plan, a Medicaid plan, something like that. If they have an Obamacare plan, they have first dollar problems, right? They can't go and see a doctor. So we're going to supplement with, when we have enough money, let's see if we can pull this off, our clinics, right? So what do you want to have? Primary care telemedicine, so that I can call the same doctor over again, urgent care telemedicine, and minute clinics. What does this mean? It means that if I have a cold, if my kid has a cold, I can show up, the kid can get care, I can get care, and it's paid for. I am not standing in front of a clinic thinking if I walk in there, what's going to happen? Is it going to cost me $50? Is it going to $200? Because half of our drivers have zero money, right? Nothing in the account. So that $250 hit is an enormous barrier to entry. It doesn't matter that their plan may include it. They are not going through to try to figure out what coinsurance is, coins, deductible. I mean, anybody in this room know what this stuff means? I study it, right? And like I can't figure out my own health insurance. I just pay it, and then I can't remember what's OCR. What does that mean? I don't know. Like this is not stuff that if we ask any normal person to decipher it, that they're going to understand. So I guess what I'm saying here is first dollar care is super important when we're talking about healthcare. Let's figure out the middle part, and for that, I think HSAs are super important. But if we're going to help people, we need to do it in a way that is not complicated. Because if it's complicated, I'm not saying people can't figure it out. What I'm saying is there are going to be some percentage of people who are not going to get care, and that is going to be way more expensive for all of us.
I'm going to just respond, Ben. I'm not suggesting that the HSA is the vehicle that will be the ultimate and the only tool. I think it is a start. Whether, we've got brilliant UX designers all over this country who can figure out how to make that user experience streamlined, clean, informative, and highly engaging. What I want people to understand is that people are spending their healthcare dollars when they have money, not when they get sick. And JPMC study came out maybe last year or so, that showed a 60% bump in healthcare spending when they got the economic impact payment. And that means people are deferring the extraordinary care. So going back to the income gap and the racialized gap, if I'm not around or I'm caring for in real time in a horizontal way, transferring wealth back to my family members or my mom or my dad at the same time I'm sending my kid to college, we need to do something urgently. And I don't want us to get tied up on the technical details about who needs to understand and how it needs to be done. There are ways, if we want to start thinking about, through the product funnel, what is possible to have people explicitly save for their healthcare expenditures, like we did with the 529s, which we know where that went. But it's possible to make a dent. And we've got to do it. We can get it done, and we have to start now.
I have a question for you, Makeda. When you say who is the we, and I don't want to assume, because I am making assumptions, but I want to hear you flesh out, like what are the levers? Who are the people in the room that will make this happen?
Good question. I think the we are the people who are progressively minded.
Yeah.
Most of us already here. The we are we're not doing this without any of those platform companies at the table.
Yes.
I don't think it's Uber cannot afford to provide health insurance. It is more afraid that, providing health insurance, immediately you have the attachment of an employee classification to all of its drivers, and immediately it goes out of business, Lyft follows, and the whole thing falls apart. So without them at the table, we're not going to get this done. But we also need the federal government. We may perhaps need to be in a place where we're thinking about a third classification of worker. It's an independent worker, I've heard it called, such that they're allowed access to the array of benefits that stabilizes them, and still maintain the kind of flexibility that they themselves, the surveys are not lying. It's people, it's drivers, it's gig service providers that say this flexibility is extremely important to me. It is state actors. And it's also, companies, again, who don't recognize that within their own stack of workers who are W-2, they're barely W-2 workers themselves. Their arrangements are very unsteady. We've seen tons of reports, the employers playing with hours such that they could keep them under the cap, not provide health insurance. All of these actors are part of the we who need to be a part of that conversation. The last group I'll add is customers. I do not mind paying an extra 2.5%. Maybe I'll take my tip, split it, and some of it goes to paying a surcharge to pay for these kinds of benefits for workers, and the rest of it to a tip. Yeah. I think customers, we who create these systems by our demand, by virtue of our demand, have to be part of this new payer system, multi-party payer system that provides stability and that pool of economies of scale that you need for these kinds of schemes to get off the ground and to scale to be part of the future.
Great, thank you. Monet, I'm going to kick it to you for my last question before I open up the floor to have a couple of questions from the audience here. So we've named complexity as being a barrier for the gig workers themselves, but I also imagine that if employers wanted to be more intentional about providing these benefits, they would face complexities as well. And so I'm wondering, from your perspective, what are some of the complexities, the barriers that employers would need to overcome to be proactive about if they wanted to begin providing these benefits for their gig workers?
I think it's similar to a lot of the complexities that Nikita just shared. I think there's a lot of not understanding current legislation. How does it apply? How do I think about that if I have a complex footprint? How do I think about the different categorizations of workers? But I think that's surmountable, right? There are hard problems we have solved before. I think these are hard things we can solve. And I think if you care about racial equity, if you care about diversity, equity, and inclusion, and all of these other pieces that lots of private sector organizations are talking about now, you have to, right? If we look at currently, even just for Black workers, there's a $220 billion gap between where wages currently are versus what we would expect if we were actually at parity of wages across the system. If you care about racial equity as an organization, you have to start tackling that. And so looking for these partnerships, thinking creatively, how do you think about some of the capabilities you have to build products and offerings that are going to be helpful to these new classification of workers, I think it's necessary.
Great, thank you. Any questions from the audience? We have time for a couple of questions or even responses, reactions to what's been shared. And I'm wondering if we also have a mic that can be, thank you, Chandra, that we can run. But any thoughts, questions, reactions?
Morning, y'all. Xavier Raymond with Justice Informed. Ben and Makeda, you all were talking about something that I think is really interesting. And one is the problem of the social costs that are created by business, which business does not have a financial response for. I think that many benefits are simply the question of what we don't provide as a human right through government, through policy, through our social contract to one another, connected to the cost that businesses incur. Like you just said around Uber and Lyft, if they were actually paying for the social costs of their business, they would be out of business, which means they don't have a financial model that is actually sustainable for people, though it is sustainable for business. I'm curious what your thoughts are about businesses themselves. Perhaps I don't know how it would happen. The question of what would be needed to create an accountability lever for businesses to be responsible for those social costs. If you all, you're at McKinsey, you're at Brookings, like you all know the numbers, right? You know what these costs create in the world. What do you think is that accountability measure for businesses to get them to maybe shift their government affairs department away from just lobbying for their own interests to lobbying for the interests of the broader community that they're impacting?
We were talking about how we're aging in a very different space and time to our parents. And I'm growing up in a time when reputation actually has taken on some tangible value in ways that make me feel so much more activated and real as a customer. So, to see in the anti-gun violence conversation, folks, shareholders stand up and say, I want my monies out of these funds, and I want to see that done immediately, and to have these investment firms respond. I think that's going to be part of this accountability piece, right? Recognizing that shareholders have value and they've got some kind of power that has not yet been actualized. I'm not talking about Elon Musk and things that he might want to do with his own unique versions of civility and social behavior. But I'm talking about the rest of us who say, these are the kinds of companies that we want our economy, we want to be the bedrocks of our economic architecture. Companies that think front and center about inclusion. Companies that say the compensation package is not just salary and bonus, but it is salary and bonus and benefits for every level of worker, from the janitor all the way up to the CEO. And when those companies start to pick up additional value in terms of their visibility, I think, we can begin to push them to act through those punitive levers of, their stock value. They respond. And I think that's part of the invisible hand that we should be using more of. But first we need some more fleshed out frames around what portable benefits mean. If Uber and Amazon Turks aren't providing health insurance or paid time off, it's not because they can't afford or don't want to. You've got some very archaic rules around employee classification. This dichotomous tension doesn't work for those companies, and it doesn't work for workers either, the ones that they're meant to protect. So it's going to be a delicate balance, but to the extent that we can use our social activism as we've done, on Twitter and in other spaces, then that's probably a good way to start introducing some real enforceable accountability such that companies begin to respond.
I'm going to be a little more cynical. Sorry. So I operate on a bedrock concept that if you put consumers against labor, consumers always win, right? This is what happened in California. We have super majorities of Democrats in both the House and Senate. They pass a law which turned every gig worker into an employee, and $100 million later, right, we have Prop 22. This is happening right now in Massachusetts, and if the bill goes to the people, I have seen the internal polling, in Massachusetts we will have Prop 22 again. We're going to lose those fights, and we have to accept that, right? So we do have to pull these levers around shareholders, but we also just have to engage the companies. The companies have to, it doesn't have to be right, but the workers don't have the pay. They can't wait for a perfect solution, right? I do think we have to restore the labor movement, right? And that is the one place, because labor unions can do things that are wildly unpopular to impose pain on the companies they work for. When we shut down the FDR over here in the bridge because drivers just stopped, that imposed a lot of pain on the city. If the drivers decide to circle JFK just for shits and giggles, sorry, because they're protesting, believe me, it'll change things quickly. New York is a $5 billion rideshare market. There's a lot the drivers can do, but they have to be organized, and we have to have a way for them to act as a power base. I don't think we can do it without the companies, though, and I think we're fooling ourselves if we think that some of the more PR-driven levers are going to solve those problems, and it can be dangerous. If we pass a Prop 22-like law in Massachusetts, which is going to be worse than Prop 22, and Prop 22 is quite bad, because we think, oh, it's Massachusetts and we're going to win there, we are just fooling ourselves, and we can't do that. It's not fair to the workers at the end of the day, and we're going to end up doing more damage because, this is a place where we're sacrificing the good for the perfect, right? We can't do that.
There's also some experiments going now with tying access to capital to some of these other ESG initiatives, and I think there's a lot more that can be done there from the private sector side as well. As soon as you have a very clear view on what these measures are, what are the specific things we're asking people to do, you can bake that into some of those expectations around getting funding and investment as well.
Great. We have time for one more question if there is one. Okay. I will squeeze in both of these questions because I'm curious. Yeah.
Hi, good morning. Joanna Smith-Romani with Aspen Institute. I am wondering how much of the issue is misclassification. So maybe not of drivers, but of home health care aides and other kinds of technically 1099 employees. And is enforcement, whatever that, I truly don't know. This is not my area of expertise. I'm genuinely curious. Is there a side that's around enforcement that could bring rightfully and justfully into employment, W-2 employment status, a whole swath of workers in our country?
I think it's somewhat complicated. So I think there are the federal classifications, and then there's also the state interpretation. And so if you have operations, just talking about the U.S., I think that is kind of complicated. So I could imagine someone trying to be well-intended and still getting it wrong in that case. And I think in that model, how do we have more resources available so that you actually can make sure that people are in the right classifications there and or thinking about where we need different classifications than exist today?
I think we've got outdated classifications that don't fit the nature of work. And that, I think, is causing a lot of friction and hesitation on the parts of these platform economies to be better employers and better partners. And at the same time, there are a fair amount of, when you say gig, it's such a big, broad, category. Folks that are performing work that is, that doesn't pass the economic test that is applied by the IRS, and then they should be W-2 employees and therefore better provided for. There just really needs to be a frank conversation about what is it to be a worker in the 21st century. And I think a lot of the scholarship about future of work skips over that and leaves it to the legal scholars, but that's fundamental to the future of work. And it might just produce something broader in terms of a spread of a new taxonomy on worker classifications. But in tandem with that should be this question of what benefits go along with each classification, and And also just kind of loosening this tie between how you access benefits based on your type of employee relationship with your employer. That's what we really need. I think, people are going to move. I mean, Raj tried to documented how stuck folks are. The fact that I'm not sure whether I can get this kind of decent coverage in just a neighboring state is part of what keeps me stuck. And so, if we're not having those very, esoteric, abstract, but extremely critical discussions, I think we're going to be here for a long time. And it's easy to vilify platform economies when, some of what they're saying in the backdrop is we need a 2 or 3 different dimensions so that we can fit our workers into those buckets and have a more robust or productive conversation that gets us moving forward.
Great. I'm going to kick it back to this person over here who has the last question for this panel, and then we'll transition.
Hey, good morning. Is it on? Oh. David Havitz from Prudential. A quick question, Makata. Towards the end, you mentioned, you said the 529s, and we know how that went. I'm curious if you think it's more on the design and the execution, and assuming it's on the execution, because where it occurred and where minorities were included and low-income individuals were encouraged and educated about how to use the program, in New York a few years ago, it seemed to be much more effective. Is there a better role for industry or businesses to help on that education side to make programs that might be designed well but executed poorly when they come from a government entity or a non-profit or any other entity, specifically the government, usually to execute them more effectively in a partnership?
Perhaps that's where I'll agree with Ben and be more cynical. That was my shortcut way of saying that 529s were never going to work, and this is not a product. That's a result of a broken social contract between higher education in this country and the families it was promised or built to serve. The fact that tuition has been rising astronomically means that no 529 plan would ever be able to provide without debt for educating any of our middle class and low income family members, families in this country. I'll tell you a personal story. I had my son, who will be 21 in June, in this very city, Kings County Hospital, in 2001. I tried to save most of that, most of his growing life. I was poor, going to graduate school, doing the things that people told me I should do. Educate myself. When I got out, I got a good job, and that job would pay for his tuition. But that was never the case. At $80,000 a year, I was never going to be able to save for him for 4 to 5 years. So he goes to school at the University of Toronto. He's there 3 years now, because that social contract provides that his tuition remains fixed for the life of his education. And when he gets out, he has no debt, not for housing, not for a food meal plan, not for any other tuition, books, or fees. And that way, his mobility begins, because the wealth that we have created, thanks to them, will be able to provide for him to start a life and generating a return on that investment. So 529s are just a Band-Aid. I mean, it's there. Utah is a good place to kind of start if you like the returns. But ultimately, the social contract around education in this country, like with retirement, like with a lot of other pieces that we're talking about here, benefits is just one thing. That's health, and that is, some sort of 401k contribution. But it's not talking about the full spectrum of what it takes to keep workers healthy and stable and thriving. So that's my cynical response to that.
I'm going to try to be more cynical. If I hear one more person talk to me about education being the problem for gig workers, I'm going to scream. Half of our drivers in New York have zero savings. Half. If they lease a car, they pay $400 a week for a Camry. That's $21,000 for a car that costs $25,000. They are so poor. Talking to them about a 401k is insane. And that's where the contract is breaking down. If we don't figure out a way to pay people more, right? All of this, I don't care how you classify people. If people don't have enough money to buy the basics, they're not putting money aside. It's not that, and I have to tell you, our drivers are quite savvy. They know what they're doing. It's not that they don't know savings is a good idea. It's that they can't afford to save. And I suspect that that's true across every segment. And I've sat in focus groups and polls, and it's just insane. I mean, I don't like the pain points for me are these. Don't talk to me about 401k and that it's about education, that if we only had better financial training for people, that they would do a better job saving. They know that this is an important thing. Don't talk to me about the same thing with healthcare. If they could afford healthcare, they would have it. People are not stupid. They just don't have the means to pay for these things. And if we're not going to address that issue, right? And by the way, we may not address that by minimum wage laws. It's got to be the labor movement, and minimum wage laws are a place to start, but we have to figure out a way, and I don't have solutions here, but we have to figure out a way to pay people more, to make sure they have basic health insurance so that if their kids get sick, they are not bankrupt by that event. You got to take care of it. Then you can have conversations about retirement. Then you can have conversations about education. And by the way, you got to raise, I mean, like, you know, $80,000, it used to be enough to put your kid through college. It no longer is.
Well, quite a place to land. Yeah, my wheels are spinning, as I'm sure are all of yours. I want to say thank you to each and every one of you for being with us this morning, for sharing your expertise, for leaning into the discourse with us. As we close, is there anything that you want to plug, promote, share with the audience, any research that you want to amplify in this moment? I just want to create a space for it in case there is something that you want to share, or a place you would direct people to keep learning. If you want
I'll plug
to.
for the Aspen Institute. I think Aspen's done some fantastic thinking around, you know, the question of portable benefits, particularly because they've taken a global view and looking to see what other models we can try to bring here and replicate, adapt. I think people should definitely plug into their work.
Thank you.
And then I would just more broadly say our McKinsey Institute for Black Economic Mobility, where we are constantly looking at new ways to publish research and thinking about closing the wealth gap that Makeda talked a lot about today.
Excellent. All right, let's give a round of applause to our panelists. Thank you for being here.